Heart failure, HF, or congestive heart failure, CHF, is a physiologic state in which the heart cannot pump enough blood to meet the body's metabolic needs following any structural or functional impairment of ventricular filling or ejection of blood. Heart failure results from changes in the systolic or diastolic function of the left ventricle. The heart fails when, because of intrinsic disease or structural, it cannot handle a normal blood volume or, in the absence of disease, cannot tolerate a sudden expansion in blood volume. Heart failure is a progressive and chronic condition managed by significant lifestyle changes and adjunct medical therapy to improve quality of life. Heart failure is caused by various cardiovascular conditions such as chronic hypertension, coronary artery disease, and valvular disease. Heart failure is not a disease itself. Instead, the term refers to a clinical syndrome characterized by manifestations of volume overload, inadequate tissue perfusion, and poor exercise tolerance. Whatever the cause, pump failure results in hypoperfusion of tissues, followed by pulmonary and systemic venous congestion. Clinical manifestations. Heart failure can affect the heart's left side, right side, or both sides. Though, it usually affects the left side first. The signs and symptoms of heart failure are defined based on which ventricle is affected. Left-sided heart failure causes a different set of manifestations than right-sided heart failure. Left-sided heart failure. 1. Dyspnea on exertion. 2. Pulmonary congestion, pulmonary crackles. 3. Cough that is initially dry and nonproductive. 4. Frothy sputum that is sometimes blood-tinged. 5. Inadequate tissue perfusion. 6. Weak, thready pulse. 7. Tachycardia. 8. Oliguria, nocturia. 9. Fatigue. Right-sided heart failure. 1. Congestion of the viscera and peripheral tissues. 2. Edema of the lower extremities. 3. Enlargement of the liver, hepatomegaly. 4. Ascites. 5. Anorexia, nausea. 6. Weakness. 7. Weight gain, fluid retention. Because heart failure causes vascular congestion, it is often called congestive heart failure, although most cardiac specialists no longer use it. Other terms used to denote heart failure include chronic heart failure, cardiac decompensation, cardiac insufficiency, and ventricular failure.